Hello, I'm Dr. Laura Fenimore, and I'm very excited to have the opportunity to interview Joslyn Soules, who is one of our former graduates. Joslyn is a graduate of our DNP program as a clinical nurse specialist, and Joslyn has a new role as a geriatric clinical nurse specialist at the Highland Hospital, which is one of the affiliates of the University of Rochester in New York. And so welcome, Joslyn. Thank you so much for joining me today. And I'm very interested in hearing first a little bit about this new role and what your scope of practice is like in that new role.
Sure. Well, thank you for having me. I'm happy to be here. So as you said, I am the geriatric clinical nurse specialist at Highland Hospital. So I am population-based in that I am working with the geriatric population throughout the entire hospital, from the emergency department to the inpatient units. I am involved with surgical patients. So I kind of see patients across the board for geriatrics, which is really exciting and I really enjoy it. I have a couple different roles. I am the niche coordinator for Highland, which is the Nurses Improving Care for Health System Elders program. So this is entirely nurse focused, and so we are focused on improving care for our geriatric patients. So it's nurse driven. We get involved in a lot of different projects for how to improve care and really reach out to the community regarding geriatric care, which is really, really fun and exciting, and nurses are very engaged with us. As having my Doctor of Nursing practice, I'm also the research coordinator. So I work with principal investigators and study coordinators on research that will be done at Highland. And I also work with nurses who are interested in doing projects at Highland or students, and helping them through that process between research and quality improvement. And I work as an advisor for our Nursing Research and Evidence-Based Practice Council as well.
Sounds like a very busy job. You've got a lot on your plate. So I'm really interested in hearing about what kinds of projects are you involved with geriatric population? What are the kinds that you're working on,
Sure.
Nurses in that hospital?
So a big project is delirium, which I'm sure you can imagine. So how that we assess delirium, how we identify it, how we communicate that to our providers, and what interventions that we put in place. You know, we have guidelines that we follow. How do we document the interventions that we put in place and what are the outcomes from those interventions? Mm-hmm. So recognizing delirium and improving our care around it, and early recognition is very, very important. So that is something that we are working on to improve our education of. Other things that we're working on are use of sound amplifiers on our units for patients who may be hard of hearing, and this puts you at risk for delirium. Let me think here. Mobility for patients, improving our mobility. Let's see, what else? There's a lot of them.
Yeah. Those sound like very important considerations when dealing
Yes.
with the older population, and we know that just bringing an older person to the hospital is a risk for any of those problems
Right.
of decreased mobility, certainly, as well
Right.
as delirium that happens just because they're away from their environment.
Yes.
Yeah. When you're working with nurses about implementing research projects,
Mm-hmm.
what is that like? And tell us what you do specifically to help with that process.
Sure. I think the first step is talking about the question that they have, and, you know, is this a clinical question? What is talking about, you know, what evidence might be out there currently? Talking about what they see the project is going to look like, and really steering them down the path of, is this quality improvement versus is this research? And really, you know, what are they looking for? What outcomes are they looking to achieve? What patient care do they want to improve? So it's fun and it's exciting, and nurses I've worked with have been very excited about the process and really engaged.
Good.
Yeah, I really.
What kind of projects do they are they interested in? What are they working on?
Oh, there's let's see, medications, the effects of medications on patients, looking at kind of improving our process, and are we, again, evidence-based practice, are we using the most current recent evidence, and how can we improve our process? So, I mean, nurses are on the front lines and they identify things that can be improved, that can be better, and, you know, they get really excited about this and they want to improve practice. And so being able to support them with that is very meaningful.
So you chose a Doctor of Nursing Practice doctorate. Why that particular role as a clinical nurse specialist, and why Pitt?
So I always knew that I wanted to be a clinical nurse specialist since I started as a nurse. There was a clinical nurse specialist who worked on my unit, and I was really interested in her role and the different topics that she would provide education on, that she would be at the bedside working with us, that she was always involved in different projects. And to me, that was very interesting to be able to do all different types of projects and do something different every day. So in looking at schools to be a clinical nurse specialist, Pitt really had a great reputation, and I was excited, and something that was very important to me was getting my doctorate. So it was a great fit. So I'm very happy that I did it. It was definitely worth it.
I'm glad that it's done. Yeah.
Yes.
Yes, right. It's relatively new for you. Yeah,
Yes.
being done. Good. As part of the DNP project, you worked on a scholarly project. Tell us about that project and what you accomplished.
Sure. So my project was looking at screening for alcohol use and dependence using a valid tool. And so we had patients who were screened upon admission with this tool, and then based on how they scored on it, we looked at how they communicated with providers and what were the outcomes of this scoring. So was a patient who was at risk for alcohol withdrawal put on a protocol to help manage that? So we looked at, I looked at a lot of different things: nursing education, confidence with caring for patients who are at risk for alcohol withdrawal, confidence notifying providers and screening for this, and using the management protocol, and kind of looking at how this tool worked for screening compared with our current care. So it was a great project, and I learned a lot from it, and we had some pretty interesting outcomes. And I think, it can hopefully pave the way and support a new process to be put in place.
Cool. It sounds like an important project that many hospitals might be able to use. When you think back on your education at Pitt, what are things that were great takeaways for you in terms of preparing you for your current role? What helped you be prepared for what you're doing today?
Absolutely was my professors. I mean, I worked with amazing professors who really supported me, and I always felt like that I could go to them with any questions or saying, hey, I want to do this. And I just felt very, very supported, which is so important. In my clinical experiences, I had incredible preceptors and was able to be involved in a lot of different projects and experiences that really shaped how I'm working today in my current role. So that was very valuable to me, and working with my advisor and being able to really go and have the experiences that I wanted to have in the places that I wanted to work at. So, I mean, it was the support I felt at Pitt, and it was the resources and the experiences that I were able to have. And yeah, it was incredible.
Well, glad to hear it. Glad to hear it. As a clinical nurse specialist, when we were talking with some other nurses, they were talking about there being differences in state to state in terms of the scope of practice. What's it like where you are?
So I work in New York State, and clinical nurse specialists cannot diagnose or prescribe in New York State. So it is a little bit different because I do have friends who can function similar to a nurse practitioner as a clinical nurse specialist in other states. That was something that I knew upfront wasn't very important to me, to have that prescriptive authority. For me, it was really about being at the bedside still and being engaged with projects and being able to work on a whole bunch of different things at once. And so, for me, I love to be able to problem solve and to fix things, and being able to jump from project to project each day or situation, or be at the bedside if I needed to have that flexibility and to be involved in various things was really what was most important to me.
Is there a typical day that you could describe for us? It sounds like there's a lot of variety in your role.
So a typical day is usually starting off with answering emails, and I have meetings, which, scheduled meetings, various meetings, but it's taking time to go to the bedside, to round on the units, to talk with the nurses, how's your day going, and learn some information, talk with patients. And then it's taking time to work on the projects further that I'm working on. I might go and teach. I work closely with our nursing education and professional development department, so I may teach for our nursing residency program or for orientation, or work with our patient care technicians. I may work in my research role where I'm reviewing research protocols for that. So it's a lot of being able to schedule my time and keep things progressing and moving forward and working on different projects. And I work very well. I work collaboratively and not just working on my own. I'm working with nurses who are working up the career ladder, working on their advancement projects. I'm working with our quality department. I work with nursing professional development. So I'm able to work very collaboratively, which is very important. I'm very happy to have that, to have people who are as excited as I am and who want to work towards change and provide the best possible care to our patients that we can, and to our nurses to provide the best possible support that we can. So that is a very important thing, that I have that collaboration and that other people have that drive and they're as excited as I am.
Your excitement really comes through as you describe it. I think the role sounds very, very flexible in terms of different kinds of experiences. Talk a little bit about what you do directly with patients. You said that you round on patients. What does that look like? And describe a little bit about the kinds of patients that you get involved with. You're not giving medications or taking care of patients, but what is your role with the patient?
So as part of the clinical nurse specialist role, I can consult patients. So it may be patients who are at risk for delirium, and we're concerned that they're delirious, and looking at what are the risk factors that might be contributing to that, what are the interventions that we can put in place, and talking with the nurse about that. It may be behavioral disturbances and dementia, and how do we keep the patient safe and the staff safe at the same time, and what can we do, what changes can we make to reduce agitation or improve the patient care experience. So that's generally, might be looking at placement, if it's going to a long-term care or rehab facility, how can we assist with that process? So it's kind of whatever they're looking for, whatever the nurses need that day. And
can you think of an example of a case where the nurses called you and said, "Hey, Joslyn, I need your help"?
Yes, I think patients who, again, were maybe a little aggressive, verbally aggressive or physically aggressive, who were unsafe getting out of bed repeatedly, at risk for falling and injuring themselves. So that's something that I've been called for, to look at how do we provide consistent care for our patients, what education is needed for everyone involved who's caring for these patients, so we're doing everything in a consistent manner. What are the triggers that these patients might be encountering, or the things that may be causing them stress? How can we reduce that? And do they have a good day and night cycle? Are they able to sleep? What are the interventions we're putting at night to get them good quality sleep? And then are they up during the day? Are we ambulating? Are we having the same consistent care routine every day? So that's a situation that I've had recently.
Okay. So 5 months is not a long time in the role, but what are you most proud of so far?
Let's see. I've been really proud of working with our quality team and nursing professional development team on a project to improve our change of shift process and looking at reducing falls and improving bedside handoff. So that's a quality improvement project that I got involved with shortly after starting. And I'm really proud of it because the nurses and the patient care technicians are extremely engaged with this project, and they've really taken it on as their own to improve care during change of shift and to make sure that our patients are being safely cared for. And so it was really neat to work on this project and do these PDSA or Plan, Do, Study, Act cycles with them, because they wanted to be part of the process, and they gave great feedback, very honest feedback, because we wanted this to be a process that would work for them, and not just something that we asked them to do. And so we've been able to revise it over time and to really make it something that they feel comfortable with and that they are able to put in place. And it's having, so far, we've had some good outcomes. So I'm excited about that and very proud.
Excellent. That when we all choose to come to nursing, many of us do that because we want to make a difference. And it certainly sounds as though you are making a difference in your role. As we close out our little conversation, what advice you might offer to a student who is where you were as a new nurse, thinking about what you would like to do with your career, and for a new nurse who's thinking about serving as a clinical nurse specialist. What advice would you offer?
So I would advise to, shadow if you can, to ask questions. I recently had a nurse that just asked me if she could shadow me for a day to learn more about the clinical nurse specialist role. I was like, absolutely, I would love that. So I think becoming a clinical nurse specialist, as I said before, you really, to be able to problem solve and to want to fix things and be comfortable with jumping around to different areas, which is something that I love. I love it every day. I love being able to do something different every day. And so, much like being a nurse at the bedside. So I think knowing what is important to you, what are your priorities for what you want to be able to do? Is it, being a nurse practitioner versus being a clinical nurse specialist? So I would say learn as much as you can would be my advice, and shadow and ask questions are the biggest things.
Do clinical nurse specialists achieve certification?
Yes, there is a certification, to be completed.
Yeah, and I believe there's a professional organization for clinical nurse specialists as well.
There is, yes. Yep.
Yeah, is it the National Association of Clinical Nurse Specialists?
NACNS, yep.
That sounds like a good place for students who might want to read more about what the role is about. Is there anything else that you would recommend that beyond shadowing, where students could go find out more information about being a CNS?
Well, I would say the University of Pittsburgh School of Nursing website would be a good place.
Excellent. Excellent.
I think, just talking with, if you're lucky to have a local CNS at your facility, and going and talking with them about what their role is and what they do on a daily basis, because it's very different across the board.
Mm-hmm.
Some CNSs, they do surgical procedures. Some CNSs, like I said before, function as a nurse practitioner. Some people work on are unit-based, some people are population-based, so it's just so different. So understanding that there's a wide variety of roles, and so really, seeing what fits for you.
Wonderful. Well, Joslyn, thank you so much for your time this morning. I think you've given our students a lot to think about and a lot to explore in terms of the role of a clinical nurse specialist, and I certainly wish you the best of luck in your new role. So thank you very much.
Thank you.